How does it feel to be the mother of a man who just made political history? Joy Thomas Moore, the mother of Governor-elect Wes Moore, joins us this hour to discuss that. And Thanksgiving, Christmas, Kwanzaa, and Hanukkah, 'tis the season to be jolly, or is it the season for suicides on the rise? The answer may surprise you. And welcome back to What's at Stake. I'm still Verna Avery-Brown, and for years we've been told that the holidays are the time of year when suicides are on the rise. But a report published by the Center for Disease Control actually says that's a myth, and in fact, those months experience some of the lowest suicide rates in the year. Our guests in this segment can help us get the 411 on this. They're experienced mental health specialists, Dr. Regina James, Chief Diversity and Health Equity and Deputy Medical Director of the American Psychiatric Association. Good morning, Dr. James.
Good morning. How are you?
Oh, I'm well, thank you. And Keith Montgomery, the Executive Director of the American Academy of Pediatrics. Good morning, Mr. Montgomery.
Good morning, and thank you for having us.
Yes, indeed. And welcome to both of you. Now, Dr. James, do you support the finding of the CDC? Is that a myth?
So actually, studies do support that suicide rates are actually lowest in the winter and actually higher in spring and summer. Now, that's suicide, right? But depression, that, feeling sad and low energy, that sort of thing, that actually, for those who have an underlying mental illness like depression or anxiety, that actually does get worse in the winter months. So that may be where the sort of, misinformation is. So people are more depressed and more sad during the winter months, but actual suicide rates are lower in the winter.
So when you say, I read something, what is the correlation between depression and suicide? Are you talking about being clinically diagnosed as depressed? Or are you just talking about, I'm having a bad day, I don't like the way things are going,
No, really talking about clinical depression, as there is, physical ailments like, hypertension and diabetes that need attention with some type of intervention. There's also mental illnesses that also need attention and intervention, whether it's talking or whether it's medication. So clinical depression is actually a mental illness that is treatable. And so that's what I'm talking about. And during the winter months, we talk a little bit about seasonal affective disorder. The months are kind of darker and they're, longer, et cetera, et cetera. That is a clinical diagnosis that can be treated. So if you do feel like you're, kind of slowing down, your mood is more sad, you may be sleeping more or less, more irritable, any of those types of changes, I would let my physician know, whether it's your family physician, your internist, whoever it is, your primary care physician, let them know about this because that is treatable. And one of the consequences of untreated mental illness can be completion in terms of suicide.
Okay, so now that we know the holiday blues myth has been debunked, but what are some of the main reasons people commit suicide? I was also surprised to learn that, everybody that commits suicide is not depressed. Which exactly. That was hard for me to wrap my head around. Clearly, they are going through some sort of an illness situation.
Right. I mean, so it could
take a gun to their head and shoot and kill themselves.
Right. So having someone commit suicide, it could be because of depression. It could be because of an underlying anxiety, any underlying sort of mental illness. There's a number of, and because you have those mental illnesses doesn't mean you're going to commit suicide. There are risk factors that can sort of accumulate to increase your risk of that. So for example, of course, having an underlying mental illness is a risk factor for suicide. Women in general are more likely to have an underlying mental illness, for example, or like depression or anxiety than men. Not that men don't, but women are more likely than men. Having a prior suicide attempt, maybe cutting, maybe trying to take pills, et cetera, increases your risk of suicide. Impaired family functioning or not having support. I mean, there's a lot of sort of variables or factors that can contribute. There's not one thing you can point to and say, aha, they're going to do it. But there are cumulative risk factors that I think put one at risk. And therefore, that's why I think it's important to really be connected to a mental health care provider or a primary care physician so that someone knows and can kind of monitor any significant change in your behavior and intervene.
Mm-hmm. But there's some main reasons that we can identify that make people decide that life is just really too horrible to go on. What are some of those? And then I'm going to talk to Mr. Montgomery about the young people.
Yeah, I'm not sure if there are main reasons, but I do think that having cumulative stress and anxiety, having not being connected to people, having access to lethal means, either having committed suicide yourself or being exposed to those who have committed suicide, maybe it could be a celebrity or a family member. There are so many factors, again, that can increase your risk. I wouldn't want to say that there is one thing that you can say, okay, if they have X, Y, or Z, they're going to commit suicide. I think what we should be concerned about is if they have symptoms or behaviors that have changed from their baseline, that they are connected with someone who can intervene, again, just so that their life is much more, they could work, they could engage with people, etc. But we don't even want to even go to the level of them having access to something to the level of suicide.
Okay. I see you shaking your head, Mr. Montgomery. Did you want to respond to that?
No, I just think it emphasizes what we declared a year ago, especially among children and teens, that there's a mental health emergency in the U.S., and it's become more prevalent, more well-known during the pandemic. The American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, the Children's Hospital Association, they all, band together to ask the government to declare a state of emergency, just because there is a growing need for resources. And during the pandemic, I think it's just kind of made things even more clear that, we need to develop more resources. So about a year ago, they all got together and asked for this declaration of a state of emergency. And then again last month, with 140 other organizations, sent a letter to the President and Secretary of Health to again urge for the declaration around children's national mental health. So, there's a growing concern out there.
So when you say children, the young people between the ages of 15 and 24 years old have the highest rate of suicides. Is life as a teenager just far more challenging today than when we were growing up? I mean, what is it about being a teenager that's putting them in the category of being the highest rate of suicides?
Well, I'll leave that to the doctor to respond and what she's seen in the clinical setting, but it goes much earlier. It starts much earlier in life. Our doctors are seeing, in the clinical setting at much earlier ages, signs of depression and anxiety in younger children. So, it starts earlier than just something that happens when somebody becomes a teenager.
And I noticed that they're attributing social media to some of the anxiety that's being created, bullying and, online bullying, et cetera. Dr. James, you're shaking your head there. Did you?
Yeah, no, absolutely. I agree that, the symptoms of depression start much earlier. If you just keep in mind that 50% of mental illness starts before you're 14, right? So that's like middle school. So half of the kids who are going to have mental illness pretty much are showing it by middle school, which means that they're starting to have those symptoms early on. as early as preschool and, first, second grade and
Well,
things
what
of
are
that
the symptoms? I mean, what do we need to look for?
Right. I think so I would say is age range dependent. So I would say in younger kids, you might see something a little bit, they're a little bit more irritable. They may have changes in their sleeping patterns. They may be talking a lot about, fears or worries more so than you've seen maybe with like your other child or just other kids that you've been around. Just not interested really in playing with other kids. They could be having problems in school, academically and sort of struggling and focusing. I would basically say if there's a change in sort of what you typically see in your child, if all of a sudden they're not wanting to play with kids, if all of a sudden you're seeing this change in the sleep habit, if all of a sudden you're seeing this change in eating habit, if all of a sudden you're seeing this change in, increased stomach aches or increased headaches for younger kids, I think that would be sort of the red flag for you to go and see someone to actually do an evaluation to see what is going on and how you need to address it. And that would be like younger kids. And I would say teens, again, similar in terms of like change in sleep pattern, change in eating pattern, but also becoming more socially isolated, maybe from their friends and not necessarily want to hang out with their friends or with family like they used to do. So really, it's sort of this change in sort of their baseline behavior where they become a little bit more irritable, isolated, and just not wanting to do the things they wanted to do before, just wanting to sleep a lot or sometimes not needing to sleep at all.
I mean, some of that sounds like normal teen behavior. And
Right.
So I would imagine that it's difficult for a parent to detect when it is at the point where it needs to be looked into. And of course, a mother or father's worst nightmare would be that their child committed suicide and that they missed the signs.
Right.
It's
and I would say that's why is important, and that I think I heard in the earlier segment with Ms. Moore, to really sort of keep in contact with your child, who they're with, what they're doing, and really getting a sense of who they are baseline. And then really seeing if there's any difference in that behavior or in the way that they interact. So that's going to be sort of your flag. You won't know necessarily if they are quote unquote depressed or going to commit suicide, but that's your flag to get some type of help or intervention. So if you see a pediatrician regularly, go to your pediatrician. They may refer you to a mental health, care provider, be it a psychiatrist, psychologist, whomever. And so that's essentially, as a parent, you can only kind of watch, monitor, and then sort of take the appropriate actions. If you feel, trust your gut, if you feel that something is kind of changing, it's better to be more sort of over responding and getting the help than under responding.
So is it a myth that if a person threatens to commit suicide, they're probably not likely to do it? And if they are threatening, how should we respond?
Well, if they're threatening, I would believe it. So that's bottom line. If anybody is saying it, threatening it, I don't think that we should sit there and try to second guess what they're doing. I would definitely, again, get some type of intervention. If you feel like they're immediately at risk, there's always the 988 number that you can call. If you feel like, you can take them to their physician, or even if it's the emergency room, I would definitely take them somewhere where they could be observed, where they can have an evaluation, and therefore you can have recommendations. But I wouldn't just assume that they're kidding at all.
Not kidding, but seeking attention.
Okay. And if they are seeking attention, that's okay. Then they need to do that, whatever it is that they need to do to get the help that they need. That could be a sign that they need help. And that's like younger kids, they may complain of headaches or stomach aches, and maybe they don't really have anything going on specifically from a physical standpoint, but from a mental health standpoint, they're letting you know something is wrong.
So you mentioned it briefly. The suicide hotline number is 988. So if there's anyone out there listening to this and they feel as though they need to call that number themselves or refer that number to someone else, the suicide hotline number is 988. 988, the National Suicide Prevention Lifeline. So,
and Verna, I'd like to jump in.
Sure.
That's why we're hosting our virtual town hall tomorrow. The town hall is called Mental Health is Essential to Good Health. We want to talk about the general issue of mental health and what resources are available in DC. We've got a number of partners that are part of the lineup for the discussion tomorrow, as well as what resources are available. We touched on it a little bit earlier that Dr. James mentioned, reach out to your primary care provider. There are innovative programs like Children's National Hospital has a program called the Whole Bear Program. It's an innovative program where mental health care providers are actually part of the mental health care team. So you can learn more about that tomorrow. It's really an important topic. When we bring it up, we want to make sure that we're sharing the resources like 988. And we think everyone will be interested in what our guests have to say and the resources that we have to share at noon tomorrow. And I can share the information about how to sign up for the Zoom virtual town hall.
Mm-hmm. What would you say, Mr. Montgomery, are the key topics that need to be addressed? I know you're saying resources that are available.
Right. So you've touched on them, recognizing the signs of mental illness, the risk, the stressors, the triggers. Some of them may be subtle. Some of them may be confused for, teen angst or anxiety. Our partner here, Dr. James, she's going to talk about racial and ethnic disparities, with her great diversity background. So, we're looking forward to that part of the discussion, along with treatment options, how to lower the barriers. We're working, another partner for us is the DC Health Benefit Exchange Authority. We'll be talking about what to look for in your insurance coverage, whether that's commercial or otherwise. Mental health is covered or should be covered, and you should know what resources are available, whether it's medication, talk therapy, online, virtual, lots of options. We want to make sure people understand what's out there.
So is it covered in most healthcare packages, mental health?
Access to a licensed provider should be covered, but you should always double check your policy to see what the exact benefits are. And that's what we'll talk about tomorrow.
Mm-hmm. Okay. And Dr. James, are there the racial disparities? I almost know the answer to that question, but I still want you to expound on that a little bit.
Well, one of the racial disparities that I think that people may be more surprised about is the rise in suicide among Black youth. So, most people will say, Black people don't commit suicide, basically, particularly young kids. That is totally not true. And there has actually been a rise in the number of suicides and suicidal thoughts with young Black kids. And there was actually a report that was published by the Congressional Black Caucus that really outlines the issues and some of the recommendations in terms of what we need to do from a federal, state, and local side. But I just wanted to get out there that this is something that is relatively new. Young Black kids are the fastest rising group to commit suicide.
So and what do you attribute that to? I mean, could it possibly be the police actions and activities towards young Black children nowadays?
Again, I think it's so many factors. Again, having that access to lethal weapons. I
even saw where poverty is considered.
Oh, exactly. Socioeconomic status. Having access to lethal weapons, exposed to people who've been killed, or even like celebrities who've gotten killed, being bullied. Things of that nature. There are so many different issues. And with COVID, the pandemic, kids were at home. They were more isolated, right? And they weren't interacting with their friends. They weren't interacting with much of anybody, doing a lot over the internet and over Zoom, et cetera. So that, too, contributed, I'm sure, as well. So there are so many different factors. But I think the key piece is that's a group that I think most people don't think about, and that we really need to pay a lot of attention to and really begin to do the research to investigate why is this the case and what can we do about it.
Okay. Dr. Regina James, the Chief Diversity and Health Equity and Deputy Medical Director of the American Psychiatric Association, and also joining us for this segment, Keith Montgomery, the Executive Director of the American Academy of Pediatrics. Thank you to both of you for joining us on this to help us to figure out and unpack some of these issues around this critical issue. During our conversation with Ms. Joy Thomas Moore earlier, she did mention that her son, Governor-elect Moore, Wes Moore, does have that high on the agenda, or has that on the agenda for his administration to tackle that issue. So that's going to do it for this week's edition of What's at Stake. Thank you to you, the listener, and thank you to my engineer, Mike Nacella. Next week, Dr. Marcia Coleman Adebayo will be in the host seat. And up next, Dr. E. Faye Williams with Wake Up and Stay Woke. And as the late man Nelson Mandela says, it always seems impossible until it's done. Ashe.
Ashe.